Hi everyone, this is Neil Wright, consultant audiologist and director of ClearWax. Thank you for joining me in this latest video, which is actually performed by an international ENT surgeon. And I'll just apologise for the quality of the video. Now, unfortunately, this video has been shared to me via WhatsApp. And whenever you share videos via the ClearWax app, via WhatsApp, the quality is just nowhere near as good. So when this ENT surgeon was performing the procedure, the image quality is exactly the same as in my videos. It's a lot more focused, sharper, clearer, more exposure. But it's just one of these things when you share via WhatsApp, you just lose the quality of the procedure. But if you can try and put that aside, this is a really interesting case. So this is a patient's right ear, and it's really stubborn wax, dry keratin, and there's a lot on the eardrum, which this consultant removes as well. And it's great watching others perform these procedures, especially ENT, because I've learned different techniques as well just by watching the ENT perform this procedure. Now, we're really hoping to get this Waxscope in this country where this ENT is based. They absolutely love it. They've been using it for a while now, and I get regular videos. It's just amazing to watch. I should start uploading more of them actually, and so we shall see, fingers crossed. And interestingly, this particular video that this ENT performed the procedure with, in the country that they're based, they're using a different type of suction probe to what we use in the UK. So in the UK, we use what we call a Zollner. And essentially with a Zollner, there's a bend in the tube, and the bend is 30 degrees, and it's 3.5 centimeters away from the tip. But this ENT surgeon, the tube that they use, it's called a Fraser suction tube, which has got a complete different angulation. And I actually purchased one to see how it works with the Waxscope, and I actually struggled with it. So obviously it's doing fantastically well with this suction tube in comparison to when I was using it. But I've recommended they get the Zollner, and they've since got the Zollner suction tubes, because that's the Waxscope was designed around that. I didn't know in different parts of the world they use different suction tubes, different angulations. And I use different angulations myself, but this is a complete different type of tube. And it had quite a wider outer diameter. So they've now reverted to the Zollner, which you can insert far easier into the ear. And so you'll see a couple more videos at the end where they use the Zollner. So this is the stubborn wax keratin on the eardrum. And this eardrum, if memory serves me correct, it's they may have had some previous trauma, previous surgery even. There's some inflammation, there's some tympanosclerosis or meningoosclerosis, some calcification, scar tissue on the eardrum. So again, I do apologise that the video quality isn't as good, but as I said, it's I can try and upload a different way to myself. I will discuss it with them via Dropbox or something like that, and I think the quality may be a bit better. So you can see the back part of the eardrum, and you've just got this on the anterior canal wall, and I think they're using the medium-sized specular, the 4.25. So there's the eardrum. So there's possibly some maybe a previous perforation that's healed inferiorly. There's scar tissue at the top. There's just this dead skin at the bottom. So this ENT normally would use an ENT operating microscope to remove wax. Where they're based as well, so I'm not giving too much away at the moment, it's very common for other specialists there to use what we call an operating otoscope. So it's not digital, you look through an eyepiece. And this ENT does provide training in earwax removal as well, so they're very keen to get this and start training others. So you can see the eardrum. There's just a bit of keratin there. So I would have found this a bit difficult using the suction tip that this consultant uses, but obviously they're very skilled with it. Obviously, to be an ENT surgeon, you've got must have extremely good dexterity. It goes without saying, because you're working in really small spaces, especially in the middle ear. So obviously you must be very talented, and which obviously this consultant is. So this is different procedure, different patient. Again, a lot of dead skin. It's sticky, and There's a bit of a lag in this video, so again, it's just the upload created that. And one of the things I've actually learned from the consultant, which has improved my technique, is that the consultant here is just staying on the wax a bit longer than I typically would. Now, obviously, you have to stay on the wax to get a good suction grip, especially with this type of wax, but he's a lot more patient than I am. He's really on there, and something that I've definitely picked up from him watching it. Like, he sent me quite a few videos. I've got about 40 or 50, and yeah, so, and he's extremely good with forceps as well. He's going to use some forceps in a moment. I've got some videos where he's using a correct. He's got his own correct that he's really comfortable with. He likes the right correct, but he's using them both actually, and but he's very skilled with the correct as well. So you can see this dead skin of the floor, and I think this is where in a moment he uses the forceps. So you're going to see the forceps, the jaws are 3 and 9 o'clock, and I think he also uses the forceps with the jaws at 12 and 6 o'clock, so he's got full orientation. And yeah, he's got loads of medical students that kind of sitting with him, and they're just amazed by the technology as well. So he's using it as a teaching aid, and he's more or less performing earwax removal now just with the Waxscope. So the portability, the usability of it, the fact that patients, I think sometimes he also streams it onto a monitor, which I personally don't feel comfortable doing. It's just, I've done it in the past, and when you go, sometimes you go close to the eardrum, naturally patients will, and I'd probably be the same, I could probably get a bit nervous because you're approaching the eardrum and you can see it, and it may cause them to flinch a little bit, but I think he has done it on a couple of occasions, and patients absolutely love watching it. So you're going to see the eardrum there in a moment. So I hope you enjoyed watching this ENT remove all that wax and dead skin. Take care, guys. Speak soon. And if you are interested in the Waxscope, please do email info@clearwax.co.uk. Bye.